Even though there's been a growing interest in CBD as a potential health aid, there's also been a great deal of misconceptions out there. Hi everyone, I'm Dr. Barry, and here is where you'll find the answers to a great deal of those common misconceptions regarding this wonderful hemp compound known as cannabidiol, or better known as CBD for short. Now CBD, it isn't going to get you high, but it's causing a heck of a lot of stir among medical scientists, researchers, and patients alike. Now, over the past couple years, there's been a surge of interest in CBD, a non-intoxicating hemp compound with significant therapeutic properties. Now, numerous commercial startups and internet retailers have jumped onto the CBD bandwagon, claiming that CBD derived from hemp is the next big discovery, a miracle oil that can assist the body in restoring optimal health without making people feel stoned or high. But along with this growing awareness of CBD as a potential health aid, there has been many, I should say, misconceptions about it, which I'm going to be able to go over today to help you clear that up. So misconception number one, CBD is medicinal where THC is recreational. Well, as a doctor, I've often hear people say that they're seeking CBD, the medicinal part of the plant, not THC, the recreational part that gets you high. So when you begin to study CBD and understand more about THC, you'll quickly realize that THC possesses some awesome therapeutic properties. Matter of fact, the National Library of Medicine reports, and it states that THC inhibits an enzyme implicated in the formation of the amyloid plaque, which is the hallmark of the Alzheimer's-related dementia. Also, in a study found in the Journal of Pharmacology and Experimental Therapeutics, it was found that THC is an effective anti-edema and analgesic agent. In the same study, an edema study that was done found that the potency of THC to be 20 times that of aspirin and nearly twice that of hydrocortisone. So full-spectrum hemp is a viable, federally legal source of THC in trace amounts at levels well below the therapeutic threshold. And number two myth, THC is the bad cannabinoid and CBD is the good cannabinoid. Well, I've heard it stated many different ways that CBD is therapeutic, while at the same time they're demonizing and downplaying THC. Well, granted, there's a great deal of stigma that surrounds THC with its relationship towards marijuana. However, it is also found that THC is also found in lower concentrations in the hemp variety of cannabis. So why is CBD touted as good while THC is generally referred to as bad? It's because CBD doesn't make you feel high like THC does. However, as these two cannabinoids work together in synergy, they may also assist the body in treating of spasticity and central pain, which is stated in the fundamental science paper called The Tale of Two Cannabinoids by Ethan Russo. Now, myth number three, CBD is most effective without THC. Well, as we all know, THC and CBD are the two most influential compounds of the cannabis plant, and they perform their best work when they work in concert with one another. Now, scientific studies have established that CBD and THC interact synergistically to enhance each other's therapeutic effects. Now, British researchers have shown that CBD enhances THC's anti-inflammatory properties in an animal model of colitis. And another scientific study determined that a combination of both CBD and THC has a more potent anti-tumoral effect than either compound has alone when tested on brain cancer cell lines. Now, an extensive clinical research has also demonstrated that CBD in combination with THC is more beneficial for neuropathic pain than either compound has as a single molecule itself. And number four myth, Isolate cannabinoids are superior to full-spectrum cannabinoids. Well, according to the federal government, specific components of the cannabis plant, primarily THC and CBD, have medicinal value. But the plant itself, the whole plant itself, has absolutely no medical value whatsoever. Go figure. You see, this is Uncle Sam's single molecule. They have blinders on that reflect a cultural and a political bias that privileges big pharma products. You see, single molecule medicine is the prominent corporate way, actually the FDA approved way, but it's not the only way, and it's not necessarily the optimal way to benefit from cannabis therapeutics. Cannabis contains several hundred compounds, including various flavonoids, aromatic terpenes, and many other minor cannabinoids, in addition to that THC and CBD. Now, each of these compounds has specific healing attributes, but when combined, they actually create what scientists refer to as the holistic entourage effect. Scientists have shown that the therapeutic impact of the whole plant, or full spectrum, is greater than the sum of its single molecular parts. The Food and Drug Administration, however, isn't in the business of approving plants as medicine. Myth number 5, and that is CBD is not psychoactive. Well, CBD is not going to cause that intoxicating effect that THC will. However, it's not accurate, definitely not accurate, to describe CBD as being non-psychoactive. Realizing that early in my investigation phase of cannabis, when I began understanding and studying it, I made the comment on social media that CBD was non-psychoactive, which triggered a conversation with a scientist in the cannabis field. And he educated me as to why that statement was incorrect. He explained that CBD has an indirect effect upon the cannabinoid receptors of the brain itself, primarily the CB1 receptor. However, it actually does have a true psychoactive effect of the brain, just not that intoxicating effect that THC has. Therefore, when a clinically depressed patient takes a low dose of a CBD-rich sublingual tincture and has a great day for the first time in a long time, it's apparent that CBD is a powerful mood-altering compound. Like I say on many occasions, and that is, CBD is not psychoactive in the same way THC is, but simply asserts its effect upon the cannabinoid receptors, technically classifying it as psychoactive. CBD won't create that sensation of feeling high, but it can impact a person's psyche in positive ways. Myth number 6. CBD is sedating. Now, moderate doses of CBD are what we call mildly energizing or alerting. But very, very high doses of CBD may trigger what we call a biphasic effect and can be sleep promoting. Now, if CBD-rich cannabis flower confers a sedating effect, it's most likely because of the myrcene-rich terpene profile within it. Now, myrcene is a terpene with a sedative and a pain-killing properties. The CBD is not a natural sedative, but it may help to restore better sleeping patterns by simply reducing the anxiety, in turn allowing a person the rest that they've been looking for. Myth number 7. High dose of CBD work better than low doses. Well, a CBD isolate, which is just that, an isolated CBD molecule, requires higher dosages to be effective in comparison to the full spectrum CBD. Now, this is due to the fact that it's actually devoid of all the other cannabinoids, eliminating what I call the entourage effect, which was mentioned a little bit earlier. Now, this doesn't mean that the single molecule CBD is a better therapeutic choice than CBD-rich cannabis, which definitely has a wider therapeutic window than the CBD isolate does. The reports from clinicians and patients suggest that the synergistic combination of CBD, THC, and the other cannabinoid components can be as effective at low dosages, as little as let's say 2.5 milligrams of CBD. Now, some patients are definitely going to require a little bit more higher dose of CBD oil to obtain the satisfactory results they're looking for. But I want you to keep in mind, CBD, THC, and cannabis in general have biphasic properties, meaning that at low and high dosages, they can produce opposite effects. An excessive amount of CBD could be less effective therapeutically than a moderate dose. Now, with the patients that I've worked with over the last few years, I've actually noticed that there's certain conditions such as pain and inflammation will require higher dosages of CBD, whereas neurologic type of health challenges actually respond best at lower doses of CBD. Myth number 8. CBD converts to THC in a person's stomach. Well, it's generally accepted that CBD is well tolerated in humans, but concerns about possible harmful side effects, which might limit CBD's therapeutic usefulness and market potential, were raised by misleading reports by Merck, a medically biased research company that stated that CBD converts to the intoxicating high of THC in the stomach. Well, nice try. But it doesn't convert to THC. And here is the corrected reference on that. I'm going to place that right down across the bottom so you can take a look at that, and I highly encourage you to read through that study that was done. Now, there has been extensive trials that have demonstrated the ingestion of CBD, even at doses over 600 milligrams, which is a huge amount of CBD, will not cause THC-like psychoactive intoxicating effects. Matter of fact, it's contrary to its actual mechanism, which shows CBD in sufficient amounts can actually lessen or neutralize the effects of the THC high. And in addition to this, the World Health Organization studied this issue and gave CBD a clean bill of health in 2017 report that asserted, and I quote, "Simulated gastric fluid does not exactly replicate physiologic conditions within the stomach, and spontaneous conversion of the CBD to delta-9 THC has not been demonstrated in humans undergoing CBD treatment." End quote. So there, that explains how CBD does not convert into THC in the stomach. Myth number 9. There is no research on CBD. Well, contrary to this statement, significant research has actually been done, and has been done outside the United States, some of which the U.S. government has made funds available for it. Now, Israel, for instance, was the very first country to actually study medical cannabis as a trusted source in earnest. Now, you can actually find studies that range from many different countries around the world. A 2018 study, matter of fact, from a trusted source from the United Kingdom showed promising results using CBD in treating ulcerative colitis. A 2014 study from Italy suggests that CBD inhibits the growth of cancerous cells in people who have colon cancer. And a 2017 study, trusted source from Brazil, found that a group of people who took CBD had less anxiety around public speaking than the controlled group, or the participants who took the placebo. Now, does this mean that CBD cures cancer, anxiety, and is the best treatment for ulcerative colitis? Of course not. But credible, randomized, double-blind CBD studies have been done, and they're available to any journalist or curious individual through PubMed, a United States National Institute of Health's research archive, and similar resources that are available. Myth number 10. CBD. You'll know within a few minutes to a few hours if it's working. Well, THC can hit you like a locomotive, and as soon as it reaches the brain, you're going to know it. However, CBD doesn't quite work the same way. Although some people report almost an immediate effect when trying CBD for the first time, that's quite rare. And depending on why you're actually taking CBD and the severity of the conditions that you're working with, you might not notice any changes in symptoms until you've been administering it on a daily basis for a few weeks. And that's why I educate my patients not to expect to see noticeable changes prior to about a 3-week time frame. Now, the best way to know if your CBD oil or any change in your health regimen is working is by clearly defining just exactly why and what you're doing prior to starting. Now, this can be done by keeping a daily record or a diary of your symptoms over a period of time. Now, I have my patients keep a journal and rate their symptoms on a 1 to 10 scale on a daily basis. This way, it's easier for you to be able to judge if your CBD is a good fit for you. Now, I hope that this helps clear up some of the top misconceptions or myths that are floating around out there about this amazing compound called CBD. And if you're not experiencing quite the response that you're looking for, feel free to contact me. It may be something very simple that you're doing that you need to modify in your CBD protocol that needs to be changed. So, thanks for listening, and look to see you next time.